Discussing the importance of nursing education. Introduction. Obtaining medical education is valuable, as it helps specialists significantly improve the quality of public health and health services. Moreover, it provides an opportunity for specialists to acquire the most essential and valuable knowledge, which will focus on improving their practices. To gain a greater understanding of this field, students need to gain awareness about the job market regarding the level of education, the necessary certificates, or degrees to perform the functions of a nurse, and the timeline for accomplishing these goals. Increasing the level of education will improve the quality of healthcare and students' competitiveness in the market, strengthen the competencies of medical professionals, and provide equality, therefore, making it mandatory. Importance of nursing education. Getting an education as a nurse is mandatory for those who want to work in the field of healthcare services. First, it makes a significant contribution to improving the quality of public health and increasing the satisfaction of individuals with received services. Another positive aspect is the increase in diverse employees who will be able to provide the necessary assistance to patients with different cultural, social, and economic backgrounds. For me, this aspect is of particular importance as an educational goal since I believe that modern medical institutions lack diversity and inclusion. This is because, for example, representatives of the Black population still face discrimination and bias. Another important goal for me is to acquire the necessary nursing competencies. This is because they contribute to the achievement of such aspects as evidence-based practice, the introduction of technologies in healthcare, and the improvement of patient satisfaction. In addition, I believe that getting a higher education contributes to gaining competitiveness in the labor market, which will allow me to get higher-level roles and competitive salaries. Options in the job market. A college medical degree opens up several opportunities for the students who receive them. On the one hand, individuals may decide to continue their studies and receive higher education. On the other hand, young professionals can start hiccuping jobs and exploring the job market. In the United States, there is a significant demand for these healthcare professionals. Bureau of Labor Statistics pointed out that demand for NPs is expected to increase by 40% from 2021 to 2031. The average annual salary of these employees is $118,000. Hospitals and outpatient care centers are the leading organizations that are looking for nurse practitioners to hire. Recommendations for achieving higher levels of education. The Future of Nursing 2020 to 2030. Charting a Path to Achieve Health Equity outlines several recommendations for achieving a higher degree of education. Therefore, one of the leading aspects is the possibility of improving the interaction between medical workers and patients, which will contribute to improving the education of the population in the field of healthcare. Further, the extension of the intelligence and professionalism of specialists prepares individuals who are ready to meet the needs and desires of various groups of the population. Gaining the competencies of medical professionals has a positive impact on the creation of effective clinical prevention and population-centered interventions that will focus on spreading equality and reducing the cost to society. One of the most valuable aspects is the promotion of social justice to provide vulnerable populations with quality services and reduce health disparities. Professional certification or advanced degrees. One of the degrees that I can pursue after graduation is a Master of Science in Nursing, MSN, and a Bachelor of Science in Nursing, BSN. Passing these programs presents such advantages as expanding the practice of nurses, which implies that they can perform actions similar to doctors. This choice is because BSN and MSN include gaining more profound knowledge about the primary responsibilities of these specialists and competencies that must be observed when performing professional functions. Moreover, obtaining this degree will strengthen my competitiveness in the labor market and open up new job opportunities. Completing the programs may take from 1.5 to 2 years each, during which I can gain both practical and theoretical experience and achieve my educational goals. Effect of increasing the level of education. First, an increase in the level of education contributes to the opportunity to find a more respectable workplace and competitive salary. This can mean getting a position in a variety of successful clinics, hospitals, and healthcare facilities that focus on providing the best care for patients and considering social justice and equality. In addition, another advantage is familiarization with a broader range of skills and knowledge, which will have a positive impact on my future medical practice and patient care outcomes. In the future nursing, I will be able to have the role of continuing various studies that will contribute to finding new ways to treat diseases and limit discrimination and bias in healthcare. It is worth noting a special connection between continuing nursing education and competence, attitudes, knowledge, and the ANA scope and standards for practice and code of ethics. Therefore, in the process of completing the educational program, I can gain more profound knowledge about the competencies that a specialist should follow and the attitudes that should be prevalent in this profession. The latter aspect also includes an awareness of what society has to do with healthcare and in what ways it can be transformed. ANA scope and standards for practice are of critical importance because they outline such indicators of activity as who assists the population, what it is, where and when this process takes place, and the purpose of this activity. The code of ethics is critical in working with people and how a specialist should behave in more severe or complex cases. In my opinion, continuing education in the medical field should be mandatory. This point of view is promoted by several reasons that should be considered at once. Henceforth, it ensures finding the most successful ways of treating the population using various relevant research and the involvement of new technologies in practice by specialists. Furthermore, it provides an opportunity for them to gain the necessary theoretical and practical experience, which can be further applied in future work. Regarding personal reasons, students with a higher degree gain competitiveness in the labor market. Moreover, it promotes greater access to health services for all segments of the population, which encourages diversity and equality. Conclusion. In conclusion, any profession in the medical field is of critical importance since its primary goal is to help the population in the fight for a healthy future. Acquiring the proper level of education within this aspect provides an opportunity to gain knowledge about how this process can be performed most effectively and receive a competitive advantage in the job market. In addition, obtaining a higher degree of education contributes to the graduation of specialists who will promote equality and diversity for all people. Therefore, this essay concludes that continuing nursing education should be mandatory.